Oh, this is getting real. So for my last update, I kind of wanted to wait a couple days to see if this got worse. And of course it did, because it's a virus and it's a pesky one at that. So this is from Reuters. Says U.S. declares coronavirus public health emergency after imposing quarantines. Now they say not to panic, but they just made it a public health emergency. So take that for what it's worth. When they pulled those Americans out of Wuhan, they moved them to March Air Force Base and put them in quarantine for up to 14 days to make sure, because that's the incubation period. Because you could be sick to up to 2 weeks before you actually show symptoms, which is kind of crazy. Now they're saying they're keeping the risk low. This guy says he wants to emphasize that this is a serious health in China, but I want to emphasize that this risk to the American public is currently low. Wink, wink. Our goal is to do all we can do to keep it that way. Whatever. The ban on U.S. entry of foreign nationals who have traveled to China during the past 14 days would exempt immediate family of U.S. citizens and permanent U.S. residents. As I said, it would not immediately clear how long the ban would be in effect. See, the flu-like coronavirus, which is believed to have originated in a seafood and animal market in Wuhan, the provincial capital of Hubei, and the first identified earlier this month, has resulted in 259 deaths in China. More than 1,100 people have been affected in China, more than 130 cases reported in at least 25 other countries and regions, with Russia, Britain, Sweden, and Italy all reporting the first cases Thursday or Friday. None of the U.S. cases have been fatal, and all but one of the patients in the United States was believed to have contracted the disease while they were traveling in the Wuhan area of China. And this is talked about what I think I talked about earlier. They moved to March Air Force Base, 2-week quarantine. Well, let's go to this here. The official coronavirus count nears 12,000, but this model estimates 75,000 infections. And then the secondary byline here says, is it time to panic? The public needs answers as cases of the coronavirus soar past 11,000, with death toll rising by the day. Let's see. Entire cities under quarantine, massive action, bodies in the streets. Doesn't sound like the modern age. The 2020 decade has started with a plague of reminiscence of the centuries past, and as confirmed cases of Wuhan coronavirus soar past 11,000. The world isn't ready no matter what our leaders tell us. I tend to agree with that. This has sort of caught everyone by surprise, because they didn't want to freak everyone out, but by not doing anything, they sort of freak everything out. You can be slow to react, which is not good, but you don't want to be quick to overreact, which isn't good either. I've heard reports of whistleblowers in Wuhan being arrested by the Chinese, so that's not good either. Let's see. The recent data now puts the confirmed cases of Wuhan, provisionally known as that big long line, at 11,374. John Hopkins data with 259 fatalities. These cases have been found in 27 countries, more being added day by day. This talks about the Hubei province, Wuhan. The situation in the United States and the rest of the world. Coronavirus cases reaching 7 in the United States. The American government has issued stern travel warnings advising American citizens not to travel to China. Unless the virus is currently spreading undetected, the United States should be able to control... should be... I like that verb. Restricting contact with China. Nations that share land borders or close sea borders with China won't be so lucky, like Mongolia, Russia, Japan, North Korea, South Korea, you can throw in there too. Russia also reported cases. Japan, Thailand, South Korea all seeing increased numbers of cases, and they may be too economically intertwined with China to prevent the coronavirus from spreading in their populations. There's... Here's what I think what's going on here. The situation may be worse than expected. I tend to agree with that. The official data paints a somewhat mild view of the Wuhan coronavirus, and independent research paints a much more dismal picture. According to The Lancet, a peer-reviewed medical journal, I'd have to look at that, make sure that's correct, coronavirus infections may be as high as 75,000, close to 76,000 in Wuhan, China alone. Such a figure could put a global cases in the hundreds of thousands. The report backs up its claim to several assumptions about epidemics doubling period and transmissibility. Notable prediction reads, and I guess this is from that Lancet peer-reviewed report, I guess. In our baseline scenario, we estimated that a basic reproductive number for the coronavirus was 2-68, or 2.68, I think. 95%, and then CRI 2.47 to 286, and that 75,815 individuals... I think these are infection rates. It's 37, 304 to 130 to 130 to 330. Have been affected in China, or infected Wuhan is as of January 25th, 2020. The epidemic doubling time was 6 to 4 days, 6.4 days. I think that's that. 95%, 5.8 to 7.1. That's pretty. I don't know what that is, but it just seems like the numbers kept going up, so that's not good. Further report, if the transmissibility of the coronavirus were similar everywhere domestically and over time, we inferred that epidemics are already growing exponentially in multiple major cities in China, with the lag time behind the Wuhan outbreak of about 1 to 2 weeks, which would make sense. Which with the CDC and the WHO are quarantining people up to 2 weeks to make sure that their incubation time that passes. If the Lantis model is correct and coronavirus is over 75,000, that would suggest the disease is not as deadly as currently assumed. However, that doesn't explain the bodies in the streets. The public needs information. Leaders give us answers before you tell us not to panic. I definitely agree. And this guy is, let's see who this guy is. William Ebbs is a writer over 5 years' experience. Woman has contributed to CCN, Motley Fool, and other wonderful clients. Okay. He's based in the United States of America. Reached at that. Okay. More of an opinion piece, I guess. But I guess Mr. Ebbs has taken it to the extreme, which, knowing how government works, what they're doing is they're telling us very little and telling us not to panic. But what Mr. Ebbs is saying is like, well, they're not telling us this thing, but here's what it could be at right now, which I somewhat agree with him. Again, like I said in my last video about this virus, don't panic. But, take precautions, I guess. If you feel sick, go get seen, but don't travel to China. And I guess, don't lick the sidewalk. That's probably your best bet. Other than that, we'll keep looking at it.